Hi, everyone. Thank you for joining. We're just going to wait a couple more minutes so that more people can get logged in.
I see lots of familiar names on the participant list too. Hello, friends. Thanks for joining today.
All right. Well, it looks like the participant count has stayed steady, so maybe we should jump in now that we've waited a minute or so. All right. Thanks again, everyone, for joining us today. My name is Sarah Hawks. I am the Field Development Manager for Connecticut, and I know I've been able to meet a few of you. I'm looking forward to meeting more of you once we can see each other in person again and get together. And for those of you that haven't heard before, I just wanted to start the meeting by sharing our mission statement, which is Autism Speaks is dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of individuals with autism and their families. And we achieve this mission through our mission objectives of increasing global understanding and acceptance of people with autism, being a catalyst for life-enhancing research breakthroughs, increasing early childhood screening and timely interventions, improving the transition to adulthood, ensuring access to reliable information and services throughout the lifespan. And before we turn it over to our wonderful advocacy team and outreach team, I just wanted to invite all of you to join us next month at our reimagined Walk on Wheels. We typically have our in-person walk every summer, and we didn't want to go a year without seeing everyone, but this year we will be seeing you from the safety of our vehicles. So we are going to have a car-based event. It'll be like going to the drive-in movies, and we will have some entertainment and a mission moment, and you'll get to see all of your friends in our community through the window, wave at them, shake your pom-poms at them. We're gonna have a great time, and if you are free on Sunday, August 16th, we'd love for you to join us. You can sign up at autismspeakswalk.org. And this is our state's largest fundraiser of the year, which helps fund all of the wonderful mission work that you're going to hear about in the rest of the webinar. So thank you, everyone, and don't hesitate to reach out to me if you want to chat about anything Connecticut.
Yay, Sarah, thank you. I jumped in before you had a chance to introduce me.
I'm sorry. Turn it over to Judith.
There you go. I'm anxious today to jump in. Thank you, Sarah. It's so good to have you on board at Autism Speaks. I'm wondering what time the Walk on Wheels starts on Sunday. Do you know?
Check-in starts at 9:30 in the morning, and the official program will start at 10, but we have lots of fun things for you to do in your car while you are waiting for the official program to start at 10.
Okay, cool. Thank you so much. All right. I know we usually have our walk in June, so I hope everyone will mark their calendars and join us in August with this experiment of walking on wheels. I think it'll be fun, but please do this. All right. Thank you all so much for taking time to talk advocacy today. I know many of you are regularly engaged in advocacy. I see a lot of familiar names of folks that I've worked with in Connecticut over the last decade. Thanks again for your commitment, for your heart, for people who are living with the challenges of autism, and for those of you who are working to expand opportunities too for people who are on the spectrum and for their families. We've had lots of conversations. I know we started, a group of advocates in Connecticut started having, I think in the beginning we had weekly Zoom meetings, and they kind of were bi-weekly, and now they're sort of as needed. So we've had ongoing conversations with members of our community, autistic self-advocates, people who are providers, special ed attorneys, and we've been blessed in Connecticut too to have people from state agencies and legislators be part of these conversations too, as we've touched base in the past. And some of the things we've heard from all of you as we've listened are just about the challenges that our community in Connecticut is facing. It's hard. This has been such a tremendous disruption to life. And for people who are on the spectrum, what we understand from them is it's even more challenging. Educational services, as you all know, just stopped, which wasn't anything any of us had ever planned for. Day programs stopped. Clinics where people might receive services, whether it's just going to the doctor for a checkup, or it might be getting speech therapy or ABA therapy, those were closed, and there was a big shift to telehealth, which is helpful in many ways. For some people prefer that, but for some in our population, telehealth has just been impossible. It's very difficult to engage on a screen like you're doing right now. And I know that's challenging for some of you. Access to mental health supports. I actually started during the time of this pandemic talking with a counselor every week to help me as the mom of someone who has autism and a severe intellectual disability. I need that mental health support to be the best I can be for myself and for my family. And I don't think there should be any stigma around that. It's just like brushing your teeth. It's so important. So I encourage all of you to seek that out too if you need to. Take care of yourself, but access to that, of course, has been challenging. Lack of connections to community opportunities and supports. And many of you have heard me talk about this. Unpredictable, but those of you who know my son, Jack, he's actually pictured here running down the path there. Our life has definitely become this uncharted path. And one thing that has been consistently on our journey is our weekly visit to the fancy restaurant, Outback Steakhouse. And we're very fancy people. Jack loves their chicken wings. And so he knows when he goes to Outback on Saturday, he starts asking for wings around 3 o'clock. And when he goes, he walks through the door, and having gone every week for, almost 10 years now, the staff knows him. They are happy to see him. They have his order ready. It's just such a beautiful connection of people who might not otherwise know one another. So it's just a disruption now because Outback has closed. So it's difficult. So I actually am having some issues with my computer at the moment. I'm not sure why I'm having technical difficulties. So I'm going to turn this over to Kelly, if you don't mind, while I correct this. Kelly Hedrick is our Senior Director of State Government Affairs, and I'm hoping that she's available right now to jump in and finish this list while I fix my computer issues. Kelly, are you with us? Thank you.
Yeah.
Okay, I'll talk to you guys in a minute. I'll let you know when I'm back.
Sure. Judith, okay. Can someone let me know where she left off? I was hearing, we've done this webinar so many times. I was hearing about the Outback Steakhouse. Where are we on? Are we on disruption of employment or respite relief? Can any of the panelists? Okay. So we know that community employment is for individuals with autism, or some individuals with autism, we know is something that continues to develop, and in fact our organization is involved in trying to help bridge the gap that sometimes exists. And so when some of those employment opportunities are hard fought and won and then have gone away during this period, we know that lots of people are facing unemployment, and this is also affecting income for families. But between community employment for individuals and the overall income of the family being affected. That's certainly a stressor. Disruption of much needed routines, respite relief that many families have services to provide, often because of concerns around spread of COVID. Those have been disrupted. Challenging behaviors, we know, often will come out in times of extra stress and disruption of that routine. So we're seeing a lot of instances of even enhanced challenging behaviors. Access to healthcare with appropriate supports. Judith will talk some more, as well as Dave, about things that we're doing to try to create the greatest possible flexibility within healthcare, but we know it's still a challenge during this time. And then within special education, we know that in many places, many parts of the country, there was either no school or there was virtual learning only. And that works well for some on the spectrum and not nearly as well for others. And so we know families and individuals have faced uncertainty about in-person, returning to in-person as soon as it's available versus virtual learning, and having to make sometimes very difficult choices about safety versus what's best for the individual in a normal environment.
All right, so I am back, and I actually am going to keep my video off. So thank you, Kelly, for jumping in. I apologize, everyone. I'm having some issues with the power source on my computer, and so if I sit at a certain angle, it works, but I'd rather you not see me sitting at this certain angle. So you saw me for a minute, but I will continue on now. Thank you so much, Kelly. And again, apologies for that disruption. It feels like a Monday, even though it's Thursday. So with all of the issues that Kelly mentioned and that I had started talking about, it affects our community. It affects it greatly. And so that really has informed the advocacy that we're taking on both in Washington, D.C. and on the state level in Hartford. They're in special session right now. And so we're going to talk about some things that are going on there. So we encourage you during this webinar to add to that list of challenges. If there are things that we haven't thought about, please put it in the chat box. You're all muted right now. I'm sorry about that, but just to try to maintain appropriate bandwidth and everything, we want to keep everything limited, but we do encourage you to type in the Q&A box or the chat box, share your questions or comments throughout. We will stop periodically to answer some of the questions. If you don't get a response directly today, we have an amazing autism response team that's available by phone. You can see their contact information on the screen. They also are available via chat between 9 and 7 Eastern every day. If you go to autismspeaks.org, we have a line also that is staffed by someone who speaks Spanish. So we really want to try to connect with the community and answer any questions you have. And the people who are answering the phone are incredibly kind and, even more important, incredibly knowledgeable. So please use this resource today and moving forward. I want to make sure that you know that it's there. Okay, so today, after our introduction, I want to talk quickly about who will be sharing today, and I hope this is a meaningful time for all of you. Sarah, it was so good to have you with us, and I encourage you all to get to know Sarah, and please take part in the Walk on Wheels. We're going to hear from David Sikowski, who many of you know and have known for many years from his time, in Connecticut, working on the Hill, and then also now working at Autism Speaks office in Washington, D.C. I'm going to talk with all of you guys about what's going on the state level, and then Colleen Shin has some really wonderful information to share about community outreach and community resources for all of you. So apologies for the bumpy start. Thanks for your patience. And now I'm going to turn this over to Dave to share with us about what is going on the federal level.
Thanks, Judith. Great to be with you all today. So as Judith mentioned, my name is Dave Sikowski. I'm a Senior Director for Policy and Federal Government Affairs. I'm based out of Washington, D.C. And as she also mentioned, I have deep connection with Connecticut. I'm from Glastonbury originally. I'm UConn grad, and then prior to coming to Autism Speaks about a year and a half ago, I worked for Congressman John Larson from the 1st District of Connecticut for a little over 10 years. So I know I've been in touch with some of you in my current capacity and possibly in my previous capacity as well. And so just glad to be back connecting with Connecticut folks. So what I wanted to do today is really give you a broad view of what's happened in Washington related to response to the COVID pandemic, kind of bring you through, what began in March and has transpired to this point, and then talk about, where the path is going from here, and importantly, focusing on the priorities that we have been advocating on throughout this time related to the autism community. So going back to early March, the first bill that passed in Congress was called the Coronavirus Preparedness and Response Supplemental Appropriations Bill. It's a mouthful, but essentially what this was the first tranche of money sent out for the public health response throughout the country to try to at least infuse some dollars, but that was really the first thing that happened. And one thing I wanted to point out is that we have these bills listed as COVID-1, COVID-2, COVID-3, 3.5, et cetera. It's really just the chronological order in which these bills passed, and you might see them referred to this way in articles coming out of Washington, et cetera, in terms of the progress of different bills. So that's really just the simple explanation there of why they're labeled as such. So the next big action taken by Congress following that first bill was the Families First Coronavirus Response Act. Included many provisions impacting our community. There was a Medicaid increase, temporary increase in funding. There was some food assistance related provisions included in there. And then, one particular important piece that was in there was providing emergency paid sick and family leave to certain individuals at employers under 500 employees. We can provide additional information. There's a lot to that, and the Department of Labor has released a number of Q&As if you're interested in terms of your own specific situation. The next major bill that passed was on March 27th. This was the Coronavirus Aid, Relief, and Economic Security Act. This is the piece of legislation that I'm sure all of you have heard about in one way or another. This was the $2 trillion relief bill that provided for the stimulus checks or economic impact payments, as they're called. These are the $1,200 per person, $500 for dependents under age 17. This was what provided the temporary increase in unemployment benefits by $600 per week on top of existing benefits. This is the law that provided for assistance for small businesses and other employers to try to keep people on payroll. Provided billions of dollars for education. Judith is going to touch on that later on in the presentation in terms of the distribution of that funding. And then an extension of the money follows the person program, which was very important to go through most of the rest of the year. So even after passing that $2 trillion bill, there was an acknowledgement by many in Congress that there'd have to be additional action taken to really tackle and continue to tackle the problems that COVID has wreaked on the country. And so on April 24th, there was another bill that passed, the Paycheck Protection Program and Healthcare Enhancement Act. And it's referred to as COVID 3.5 because it was a very narrow bill. It wasn't meant to address all of the different challenges that individuals and businesses and state and local governments and others are experiencing. It really was primarily meant to replenish the Paycheck Protection Program, that small business forgivable loan program that ran out of money very quickly back in April. And so there's an effort to both replenish those funds as well as provide some additional money for testing and healthcare providers and hospitals, et cetera. Can you go to the next slide, please? So what's next? There's been a flurry of activity over the past several weeks around this that you may have read about in the news, including even today. There was some news around this. But back in May, the House of Representatives passed a bill called the HEROES Act, which was a $3 trillion relief package. This provided for a whole host of different things. So, additional stimulus checks, about $1 trillion for state and local governments, a fix for the postal service, housing related provisions, et cetera. And so while this was the House's attempt to kind of put forward the next large relief package, it was really kind of the opening salvo in negotiations around the next large bill. The Senate pretty much immediately, Majority Leader McConnell said that he was not going to be taking that bill up in the Senate, that they would be crafting their own package to then, I think, negotiate with Democrats in the House. And so while that was passed in the House back in May, since then it has not been taken up in the Senate. And we did want to point out a few things that were included in the HEROES Act that we thought were positive. So a substantial increase in funding for home and community-based services, $100 billion for education, and that was on top of the $1 trillion in assistance for state and local governments. I'll touch on the dependents over age 17 in a minute in terms of the economic impact payments. And so right now we're at a point where the Senate is beginning the process of putting out a bill related to COVID relief. Today, there's going to be a release of one portion of that bill, and there will be more apparently coming in the next few days around this. So right now, it's pretty unclear as to what will happen in the final analysis, but there is going to be a congressional recess coming up in the next few weeks. And so I think the thought is at this point that there will be an attempt to negotiate an agreement before that date. But as to what the specifics of that agreement look like, it's very unclear. You can go to the next slide, please. So, throughout this crisis, we've spent a lot of time trying to connect with the community, trying to hear what the challenges are that individuals on the spectrum are experiencing, what families are experiencing, and trying to translate that into action and to bring those concerns to members of Congress. And so, on here you have there's a list of things that we have been working on. It's not all inclusive. It's just some of the top level things that we've worked on. And as Judith mentioned, we're constantly trying to seek feedback and to understand any additional things that we should be aware of and should be working on. And so please don't hesitate to get in touch with us. So, as you can see here, the first priority, additional funding for home and community-based services. This is to try to enhance the funding going to these services from the federal government. And this is to account for additional personal protective equipment that's needed for caregivers. This is to try to boost pay for those individuals who are working in this field to try to ensure continuity of a workforce and a whole host of other flexibilities and additional ways that HCBS can be supported. And so we have been making that a big priority. Additional funding to meet the educational needs of students with autism. As Judith and Kelly alluded to, it's just been such a huge disruption. And while for some students, remote learning has been manageable and been okay for some, for many others, anything less than the in-person comprehensive services has not been adequate, to say the least. So what we've been doing in terms of our federal advocacy is saying that whatever is done in terms of the federal government response, that there should be dedicated funding provided to states and to local school districts, specifically to meet the needs of individuals with disabilities, individuals on the autism spectrum. We actually just sent in a letter of support from Autism Speaks the other day in support of legislation that Senator Chris Murphy from Connecticut has introduced that would provide a dedicated amount of $11 billion for educational supports, primarily for individuals and students with disabilities. And so that's something that we're continuing to press on as these negotiations move forward. Protecting the rights of students under Individuals with Disabilities Education Act. Throughout the past several months, there had been a lot of concern that some of the core protections of IDEA might be rolled back in order to try to deal with the current disruption of educational services. And we push back on that along with many other organizations. And fortunately, to this point, there has been no waiver of the core protections of IDEA, passed by Congress. But we will continue to stay vigilant on that. And again, Judith will touch more on the topic of education later on. Expanded access to telehealth services for healthcare needs. For some individuals, again, this access to certain telehealth services has been very, very beneficial. We don't think it necessarily should be a replacement for all healthcare services, especially after we get past this pandemic. But what we have been advocating for is to allow for the continued availability of telehealth services that work for people that are on the autism spectrum that are beneficial, and to allow those to continue going forward. So one of the quirks of the March 27th law that passed was a limitation on availability for economic impact payments to dependents only under the age of 17. We heard a lot from the community about this, and a lot of frustration about why dependents over the age of 17 wouldn't be eligible. We agreed. We've been working with a coalition of other organizations to try to fix this. There's been fortunately a lot of support in Congress. We've endorsed bills by Congresswoman Angie Craig from Minnesota, and Senator Tina Smith, also from Minnesota, that would look to address this. It was addressed in the HEROES Act. As I said, that bill hasn't moved forward after it passed the House, but it's a priority we're continuing to push for, to allow those payments to be made retroactively. The next bullet point refers to the emergency paid sick and family medical leave policy. So when that passed back in March, there was a lack of clarity in terms of who would be eligible. There are a number of categories that would allow someone to avail themselves of emergency paid sick and family medical leave, including any illness related to or having to be out due to a COVID-related illness, or a family member's COVID-related illness, and a number of other categories, which included the closure of school or a childcare center. But what wasn't clear was whether or not individuals who are caregivers of adults with disabilities would also be eligible. We advocated, again, with other organizations as well, that there should be a clarification there. And fortunately, the Department of Labor did make that clarification in a rule that they issued. But it's, again, something that we want to continue to stay vigilant on and ensure is prioritized. And finally, but last but certainly not least, is preventing discrimination in treatment decisions and care allocation based on disability. This is an ongoing concern, but something certainly at the outset of the pandemic, when some states were particularly initially hard hit. There was concern that there were some treatment decisions and allocation of resources to certain patients rather than others based on a disability. And so we applauded the Department of Health and Human Services Office of Civil Rights, who issued a guidance bulletin essentially to medical providers across the country, saying that they shouldn't be engaging in that practice. There's been a lot of action on the state level as well, in a variety of different cases. And in addition to that, we've also spoken out about ensuring that personal protective equipment is provided in an adequate way in group home settings, and we've also touched on issues related to hospital visitation and in certain circumstances, and individuals with disabilities not being able to have a family member with them during their stay. And so it's something that we have put out a statement on as well. So we have been in touch with many members of Congress regarding these priorities, including members of the Connecticut delegation. So I mentioned here that Congressman Chris Smith and Mike Doyle, who chair the Autism Caucus in the House of Representatives, have sent letters to leadership advocating for many of these priorities. We're in touch with those offices, pretty much every week. We talked to them just yesterday, actually. And one of the letters they had a very quick turnaround on. They got 40 members to sign on, including Congressman Larson and Congressman Courtney. But we've also had great conversations as well with Congresswoman Hayes DeLauro and Himes, as well as the Senate offices as well. So those have been the areas that we have been focused on. We're going to continue to be pushing for these priorities and others. And again, welcome your input as we continue to move forward. So I know I threw a lot of information at you all over the past few minutes, and I'd be happy to take questions now, or if you have questions offline as well, we'd be happy to respond to them.
All right, Kelly, do we have any questions in the chat box that we need to discuss? And thank you, Dave. That was amazing.
We don't have questions, but I want to add that when we were talking about challenges, Tammy reminded us that she's dealing with kind of a heartbreaking situation where her son, who's an adult in a group home, is not able to go to their home for a visit. And of course, you know, he doesn't understand physical distancing, and you know, wants to jump in the car with them if they're there to try to see him outdoors. And that, you know, some agencies are allowing family home visitations and others are not. So that's a difficult situation that, you know, we want to acknowledge many families are dealing with as well.
Yeah, I can't imagine, you know, weeks and months where people are not able to go home or to be able to visit with their loved ones. And we certainly understand the public health protections that people are trying to enforce, but also just connection, love, those things are so important too. So we hear you, Tammy, definitely. I know that's a huge issue. And as this situation continues, it's definitely something we need to keep our advocacy eye on. All right, so with that, who's excited about talking about state advocacy? And again, I apologize, you can't see me, but I'm actually sitting on the floor with my dog now, but my computer is charging, so I don't have to worry about technical difficulties, hopefully. Now something will happen, like I'll be struck by lightning or something because I said that. All right, so many of you have been engaged in state advocacy with Autism Speaks through the years, and you've really made a difference. I have to laugh. This is actually a really bad picture of me that was taken by Shannon from the ARC of Connecticut. We were at a hearing around a bill we were working on back in March. We had a hearing early March. And so we were there testifying in support of this bill around autism and employment. And it was such an exciting time. It was a bill that really was developed after we had one of our transition forums in Connecticut with Autism Speaks and ASRC. And so anyway, the community had come together with this bill, and this was the hearing that went very well. And then the next day, the Capitol closed, the Legislative Office building closed, and subsequently our bill died. But this was the day before everything closed. But just know that, you know, we definitely have pivoted and we want to continue to make a difference in Connecticut. And we definitely will not abandon this effort around employment, but just a little throwback there. When we pivoted, we connected with many of you, as we've mentioned before during this webinar, and we kind of decided to focus on 3 specific areas: healthcare, home and community-based services, so those services that you get through like DDS or DSS, and then of course special education and early intervention services. So I'm going to talk with you guys quickly, kind of catch you up. Many of you already know some of the things that have happened. I'm going to try to catch you up on where we are and the work we have to do moving forward to maintain benefits and expand those that are needed moving forward. All right, so first of all, let's talk about healthcare, and specifically, we'll talk about Medicaid. So for many of you, when we talk about Medicaid, that means your Husky plans that you use. And so there was a waiver that was approved. There was like a blanket waiver and some other provisions. It's called an 1135 waiver that was approved that affects those Husky plans. And then there also was a different kind of waiver in Connecticut called Appendix K, and that's really more for home and community-based services. So waiver services you might get through the autism waiver, or if you have a waiver through DDS, Appendix K affected those benefits. And it was interesting, when we applied for Appendix K, we had Representative Abercrombie, Representative Gilchrist, others on the phone with us as we were talking about the things that we needed. And so these were the things that were approved that are supposed to help Connecticut families access health care and also those home and community-based services during the pandemic. So the provider enrollment is supposed to be easier. Pre-authorization requirements were relaxed, as was the appeals process. Supposedly alternative settings could be used. So for instance, if you couldn't go to the doctor's office and you're a Medicaid patient, you could engage in an appointment through telehealth, or, you know, perhaps services could be provided in-home rather than at a clinic in some other way. Self-directed workers can be paid during member hospitalizations. So Meals on Wheels for certain people in their home are provided. And other things like retainer payments to help programs stay afloat, like those residential and day programs. And then again, just telephonic and telehealth provisions. Speaking of telehealth, for those of you that have utilized it through Medicaid, that has been extended for a few more months. And for those that have private health insurance, there was an executive order that Governor Lamont issued early on to make sure that people had access to telehealth. Those provisions will eventually expire. So right now, the Connecticut legislature actually went into special session today, and it's a weird, like socially distanced kind of special session. And they're only working on maybe 2 or 3 things. One of them is police reform. And then one of the other things that they're looking at is telehealth. And there's a bill that would extend the current telehealth coverage out to June 30th of 2021. They had talked about just making it permanent, but they said, no, let's just, in this bill, make it go out to June 30th of 2021 so we can really see how it's working long-term. So stay tuned on that. And I would definitely love to hear your thoughts on telehealth. As I mentioned earlier in the webinar, for some folks, it seems very beneficial. For others, it's challenging to access it. It does cover services like behavioral health, including applied behavior analysis, therapy sessions, things like speech, occupational, and physical therapy, also the psychological and psychiatric supports that are so important during this time. Okay, moving on quickly to special education and early intervention. Autism Speaks, after talking with the community and working together to identify priorities, reached out to the governor. There, early on when the Autism Cares bill was passed, and Dave mentioned this earlier, there was funding that was sent down to the states to help with education. And we're certainly hoping that there will be more, but that funding allowed governors to have discretion. And so we reached out to the governor and we reached out to key legislators to ask that some of that money be used to help the autism community in Connecticut. So the money that Connecticut actually received from the CARES Act, they got $104 million that has to be allocated to K through 12 resources, $131 million for post-secondary, and then Governor Lamont has $26.8 million that he can allocate at his discretion, and those dollars are being allocated even now through a grant process through the Department of Education. Autism Speaks has asked specifically that they consider accessing hardware, software, and communication devices and other assistive technology for our community so that they can engage in remote learning when it's appropriate. We were very concerned about what happened with children who were in early intervention, who were going to be turning 3 and going into special education. We also, skipping to the bottom bullet, were concerned about students who were transitioning out of special education at the age of 21 and trying to make sure that those who were doing that during this time of school closure actually got transition services that they're supposed to. And then the other thing that we've been advocating around specifically is trying to make sure that those services that have been lost, that have been missed during this time of closure. And again, it's not the school's fault that they had to close. It's not the family's fault that it's so challenging to access remote learning. The pandemic is what it is, but the reality is, and you have all lived this, services have not been accessed. Services have been missed. And so at some point, those services have to be provided. And so we're asking that they be provided as soon as possible, in person if it's safe. We know our community has different feelings about that. For some, in person, we hear from families that they're desperate for this access. For others, we hear a voice of fear and concern about in-person services, and we want to respect all those positions, but we want families to have options for in-person services as soon as possible, including now in the summer, although we're rolling into August almost now, but we are pushing just to make sure that families have access to appropriate special education services that are safe and meaningful. If you want to find out more, we're going to send out this presentation to all attendees after it's over. We're going to send you an email with a copy of this webinar. The links that are here are live, so you can click through. So I encourage you, at the bottom of this slide, there's a link to the Connecticut Department of Education, and there you will find, and some of you may have already looked at this, guidance from the Department of Special Education about reopening and what's going on there. There are some good things there related to early intervention and transition out of special education. The advocacy in which we engaged was meaningful, and early intervention children were given more options about how to access services that they missed in early intervention for those kids who are turning 3. And then also there's guidance about students that are exiting out, that are transitioning and turning 21, and trying to find a way to provide those services. So to families, I would say, as you're struggling with the special education situation, it's just a challenge. Please know that we're trying to advocate at the state level and also on the federal level. And as you are able, I know this is a trying time and you're exhausted and there aren't enough hours in the day, but I encourage you to reach out to your team that developed your IEP. Don't be afraid to ask for individualized services, even though your town may say, hey, we're all virtual. That doesn't mean that you cannot ask on your IEP for individual services provided there, depending on the needs of your student. So that's just an example of something that you can do if you are able. The other thing I would encourage you to think about doing too, as organizations like Autism Speaks and others advocate at the state and federal level, we need families and engagement on the local level, and that is you. So if you're able, or if you have loved ones that are able, or friends that you can provide good information to, I encourage you to engage in those reopening efforts, the school committee meetings as much as you can. If the special education community isn't present, if the autism community is present, they won't be prioritized. And so our voices all matter. So I encourage you, if you can, to get involved. And you can get involved with us, the efforts that we are pursuing on the state and federal level. Connecticut has been such an example of great advocacy through the years. This is a picture from last year when Connecticut successfully passed legislation to change the transition age from 16 to 14. Just one thing that can make such a huge difference. We have a lot of other work to do, so please follow us on Autism Speaks Advocacy on Facebook. You can follow us on Twitter at Autism Votes or on Instagram at Autism Votes. If you'd like to be involved in our regular Connecticut Zoom meetings when they are happening, right now they're on an as-needed basis. Sometimes they're monthly, sometimes they're weekly, just depends on the time of year. But we would love to have your voice. It's a great group of people, a great group of problem solvers. You can email me at judith.ursetti@autismspeaks.org and I will add you to our group. You are welcome and encouraged to be part of that conversation. Okay, with that, I'll stop. I don't know if we have any questions. We still have some good information to share with regard to community outreach.
Judith, no questions, but Thomas wanted to share that it's his understanding that the telehealth authorization will end no earlier than the end of June 2021 is what he's hearing. So another extension he believes will be coming to keep pushing that out to next summer.
Okay, great. Thank you, Thomas. All right, everyone. So we're going to continue on. I'm very excited to now pass the baton to Colleen, who has a heart for our community and a lot of great information to share. So Colleen, please take it away.
Thanks, Judith. Hi, everybody. Thank you so much for joining us today. I know your time is precious. I'm Colleen Shin. I'm the Outreach Director for Autism Speaks, and Connecticut is part of my territory. So I'm really lucky to work closely with this team, and thank you again for your time today. I've been with Autism Speaks for 5 years. I've been in the autism community as a direct care worker for over 30 years. So this is near and dear to my heart, and I'm just so proud to work with this advocacy team and the work that they do. I hope you guys feel how committed they are to helping through this process and just ongoing. You can go ahead to the next slide, Judith. I will tell you that in all of my years of doing this, I have never, ever experienced anything like this. I don't think we ever will again. I know that this is a huge challenge. I've worked across the spectrum and throughout the lifespan in many different roles, and I know how hard this is. And I'm not a parent. I don't have a child with autism. I don't have an adult or a loved one in my life, but I've had many people who have touched my life throughout the years, and I know how hard this is. I truly do. So please know that when this all happened in early March, we really shifted as our mission area, and I'm with the services and supports team, to look at how we can best support the community through this. And we created a lot of fantastic resources that really do address, as much as we can address very individually, how this could impact everyone. And everyone, you know, it really isn't just the autism community, people with autism and their families, it's professionals as well. And so we really had to think about what we can do and how we can address this, and what resources can we create, what community partners do we have, and collaborations that we have with some other wonderful organizations that are also creating some great resources. And I just want to stress again, and I've heard quotes, and I've said this on other calls, you know, sometimes people say, well, we're all in the same boat. And that's not really true, because everybody's boat looks very different through all of this, but we're weathering the same storm. And we know that, and we are here for you, and I hope that you reach out to us. Next slide, Judith. One of the things that is probably something that a lot of people don't know about, and we want people to know about it, so please share this out widely, is our Autism Response Team. We refer to them as ARTS internally, but they are the Autism Response Team. If you have not utilized this resource, please do so. We're lucky enough to have one of our associates on this call. Her name is Martha, that oversees the Connecticut area. You can contact these guys. There's 3 ways to contact them, actually. So the 800 number is listed here. It's 888-AUTISM-2, or numerically it's 888-288-4762. You can email them at help@autismspeaks.org. We have a Spanish-speaking line that you can contact directly at 888-772-9050. And we've recently introduced a live chat on the website, which is really nice because you can talk to somebody live. And who can use this? It's really open to everyone. And we do have a variety of people who utilize this. We have self-advocates who contact us more frequently now through this, I believe. We have parents and guardians, caretakers, professionals that work in the field. It's really open to anybody. And these guys are dedicated to finding resources for you. We've had a lot of people who just need to talk to somebody through this, and they're there for that too. They're just a wonderful group of people. I've worked closely with them, and I'm very fortunate to have done that throughout the 5 years that I've been with Autism Speaks. And please know that they're here to assist you in any way possible. And like I've said, we might not have an answer to every single question, because really through these times that are so unprecedented, I don't think anybody has answers to every question, but these guys are here to help you, these guys and women, and they're wonderful people. Next slide, please. So some of the very specific resources that we have are available on our website. So if you go to autismspeaks.org, you will see a gold banner at the top of our landing page, and you can click on there for resources. And there are tons of different resources. You can spend a really long time looking through these if you have time to do that. If you don't and you're looking for something specific, I would encourage you to contact our Autism Response Team. But we have different sections. So there's one for virtual learning and summer activities. I love this. I looked through this most recently, and some really cool things on there. And again, different categories that are really age appropriate and for the entire spectrum, a lot of different choices. We have just basic autism and COVID-19 resources. how to handle clinical care during social distancing and program closures. And then really just in general, what does the autism community need to know during this outbreak? Again, lots of different links. If you click on each one of these, and there are different categories for adults with autism, for the healthcare community and providers, for families. They're wonderful. And a good way to stay engaged with us and become engaged is to join our local Autism Speaks group, the Facebook group. And we post a lot of these different materials and resources on there. So that's a good way to see these. And I think somebody just asked about the links, and I believe these are all live, and you'll receive this presentation after this is over. Next slide, please. If you go to, again, autismspeaks.org, the other thing I'd really encourage you is we have so many fantastic resources outside of COVID resources that are also that you can obtain by going to our website. And we've organized these by topic. You can also search them by level of need, which is really great. And so there's a financial planning section, there's safety, there's school section, technology, health and wellness. All of these are listed. And if you click on these, again, they're really fantastic because you can search by level of need, by your topic, and a bunch of different resources will come up if you click on each one of these links. Again, really great information. And if you don't have time to search through these, again, please utilize the Autism Response Team because I just cannot, I can't brag about them enough. They're just wonderful. So email, call, chat. If you can get a hold of them, you need to do that because they are great, a resource for you. I believe that's it for me. And I think that we have a couple, nope, it's 11:59, but if there's any other questions, we have 1 minute to do it, and I'm going to kick it back over to Judith. But thank you so much, and please understand we're all here for you, and that we understand what you're going through, and we want to be here to help. So stay safe, please, and be well, and thanks so much again for your time today.
Yes, thank you all so much, and please make sure and check your email inboxes. In a few hours, we'll be sending out the presentation. This has also been recorded, so the information will be posted, and we can share that recording with all of you too if you want to watch it and go back if you'd like to get your information that way. Connecticut, thank you so much for taking time to listen today, to learn, and to work towards solutions during such a challenging time. I hope to talk with all of you soon. Please take good care.